You're listening to the Contented Catcast from St. Claus Academy with Lisa Sinnott. Email stclausacademy@gmail.com.
Delighted to be here with Dr. Katrin Jahn today. She is a veterinary behaviourist. She also has lots of wonderful courses available if you are travelling from different countries with your pets. Obviously, that can be a stressful time for them. So as a vet, she has devised lots of wonderful guidance to help cats and dogs feel safer during that vet visit and also their travel visit as well. So how are you today, Dr. Katrin?
Really well. Thank you so much for inviting me. Happy to be here.
All right. Thank you so much. So obviously you work in a veterinary environment, and while a veterinary environment can never be completely stress and fear-free, there are lots of things that cat parents can do and also veterinary staff can do to alleviate that stress. What kind of things do you use in practice to help with that?
Yeah, it's a great question. I think you've already sort of touched on probably the most important point, which is that it's a bit of a team effort in that, you know, both cat parents as well as the entire veterinary team, that's everyone really from the receptionist through the nurses right up to the vets, all potentially can be and should be involved in making that visit a little bit less stressful for cats. So if we sort of think about what the cat parent can already do at home and what perhaps the veterinary reception team can advise on, we give lots of guidance around how to actually familiarize cats with their carriers, to make the travel to the veterinary clinic as smooth as possible, because we know that's quite a stressful event in itself. So perhaps using pheromones, how to actually familiarize the carrier in the environment, making it a bit of a sort of a resting and sleeping place for cats in the home, so that they don't always associate the carrier with going to the veterinary clinic. So those are some of the things that we would think about sort of from an at-home point of view. And then when they get to the veterinary clinic, we always try and make sure that they are in a space that's separated, especially from dogs, that their carriers are placed up high. So cats hate being down on the floor. They feel quite vulnerable there. Again, we'll use potentially pheromone products in the veterinary clinic. We'll try and keep noises and smells and sort of anything that they can see, hear, smell. We'll try and keep those things to a minimum. And then that goes through into the consult room, where we then use sort of stress-free handling techniques. And very importantly, we also do use quite a lot of what we call pre-visit pharmaceuticals, which is medication that can be given to the cat at home before the vet visit. And that really works to help relieve fear, anxiety, and stress. So that's especially for those cats who feel very worried at the veterinary clinic, potentially for any cat, but certainly those cats that have maybe had prior learning from being at the vets and are now, really worried about going to the vets, and their behavior may escalate even to showing signs of aggressive behaviors because they're so scared. So there's lots and lots that can be done.
So in terms of the medication, is cat parents have kind of reservations about using medication in terms of the side effects, or they're worried about long-term effects that it might have, which people have mentioned to me before about in terms of reservation. What would you say in terms of how the pharmacology actually works?
Yeah, so, obviously we have a couple of different options at our disposal. The most commonly used pharmaceutical now is a medication called gabapentin or pregabalin. They're both in the same class of medications. And there's been lots of research done on that medication in cats, which is great because we don't have a huge amount of research on potentially other medications, but there has been some done on gabapentin and pregabalin. And there is now actually a veterinary licensed product on the market, a pregabalin product called Boncat. So that's been specifically formulated for cats. And in terms of the pharmacology, gabapentin has actually been shown to be extremely safe. We hardly have any side effects. Probably the most common side effect is that they get a little bit sedated, which is maybe not a hugely bad thing for vet visits. I would say sedation isn't ideal if you're giving gabapentin at home on a regular basis for something else, maybe for managing pain. But if it's used as a pre-visit pharmaceutical, then that sedation piece as a side effect usually isn't that problematic. And I think in the studies, it's mentioned that very, very few cats had some gastrointestinal side effects, so maybe some nausea, some vomiting, but that passed very quickly within a couple of hours. So gabapentin and pregabalin are, in my mind, very, very safe, and they have a fantastic effect on cats. Now, there are other medications such as maybe benzodiazepines. We're thinking about alprazolam. Maybe we should never, ever give diazepam or Valium to cats by mouth, but we can use others. Alprazolam and lorazepam are probably the two most common, but they could potentially come with side effects. So we can see sort of the cat actually going the other way and getting extremely hyperexcited, which we obviously don't want. So they would be medications that I perhaps wouldn't use as freely, maybe only if there were a contraindication to gabapentin, of which there are not many. Kidney disease is probably the only contraindication. And even then, you can just use a much lower dose of gabapentin, and you can still use it even in cats that are affected with kidney disease. So if we're thinking gabapentin, pregabalin, I really don't have any huge concerns in terms of safety for use. And it's a one-off medication, right? So it's given as an event medication before the vet visit, so there shouldn't be any long-term effects at all.
Sure. And in terms of, obviously you touched on things that we can do beforehand with our cats. Carriers, obviously the carrier is really, really important as well. What kind of carrier do you recommend as a vet?
Yeah, this is a brilliant question, because I have in my career taken apart 100 million carriers, and probably 99.9% of them have not been suitable for whatever reason. So when I think about a carrier that's an ideal carrier for a cat, so the first thing is it's got to be safe and well ventilated. We'd like it to potentially be plastic, so it's easily cleanable. We always need to think about carrying the carrier from the bottom. We never want it to sort of swing around and dangle around, or God forbid the handle break off. I've seen that happen before. And what we really want is a carrier that's very easy to take the lid off of. So there are some that are almost like a little clamshell carrier where you can sort of unzip and the top kind of folds open, and you can then come in with a little towel or a blanket and cover the cat over as you're opening the top, which facilitates really nice examination and handling. Or you can get some carriers where taking the top off, the clips aren't too noisy, and the door also isn't prone to falling in and landing on the cat. So these are all the things that I commonly encounter. You have to, it can be quite noisy or stressful to even just get the top off. So a carrier that the top comes off of easily. And then what we usually do is, as we slide the top off, is we slide a towel over the cat so that we maintain that sort of feeling of them being hidden and cocooned and safe. But we can then, with the towel over the cat, gently start our physical exam. What we don't recommend are some of the things that we see more recently, sort of the fashion trends like backpacks, where, the cats are in this sort of plastic bubble, if you like. That can be visually very sort of exposing for the cat, and then the action of being carried around in the backpack can be quite stressful for them as well. There are some question marks around your fabric carriers as well. They can easily kind of collapse down on top of the cat. Although for air travel, which is something that you mentioned, Lisa, for air travel, the fabric carriers sometimes are necessary for if the cat's going to travel in the cabin with the owner. So a few things always to consider, but yeah, those would be my kind of top considerations for carriers, I think.
Thank you. You obviously mentioned a lovely, I've got a lovely image now, the cat in a cocoon, feeling quite safe and, hidden.
Yeah.
So important for cats. Obviously, cats can't talk to us. I don't know what they'd say if they could, but they can obviously speak to us through their body language. Obviously, in your course, what kind of things do you talk about? I know, obviously, with some cat parents, I talk about ears, that they are really expressive if we're noticing aeroplane ears, that flattened ears, that can be a sign that's really that they're worried. Obviously, Scottish fold cats can't obviously communicate with us via their ears because of what we've done to them. But what kind of things do you cover in the course for people that might be interested?
Yeah, so in my Learn to Speak Cat course, what I've done is basically packaged in a super easy to digest course all the things that I commonly speak to my behavior patients, owners about. And communication, body language, facial expressions is a big part of that. But even going one step before that, the first thing I actually talk about is emotions and emotional states. So what are the emotions that we think cats can experience, and what are the emotions we don't think cats can experience that are more of a human construct? So things like jealousy or spite, some of those things which we don't think cats necessarily are experiencing. And then from that emotional state, then I go on to talking about body language, because if we understand the emotional state that they're trying to communicate, then it makes sense for us to be able to look at body language and think about, like you said, ears rotated sideways, dilated pupils, eyes wide open, tight little muzzles with whiskers splayed. Those potentially can be signs of fear, anxiety, stress. And then on the other side, we've got, signs of frustration, which could be vocalization, tail lashing or tail thumping, trying to escape confinement. Those would all be things that would be more associated with frustration, perhaps. So I start off with the emotions and then go on to body language and communication, because then I think people understand what they're looking for. And then, so it's a 6-module course. Those are just the first 2 modules. And then I go on to talk about sociability and learning and training, the 5 pillars of a healthy feline environment. And then I go through some of the products that I think are really useful for behavioral health in cats. So not psychopharmaceuticals, but things that can be bought over the counter potentially, and things that pet owners can really easily do themselves to improve their cat's behavioural health.
Brilliant. Okay, great. And what is your kind of feelings about scruffing cats?
That's a dirty word in my vocabulary.
Okay, good. Can you? Because obviously I hear sometimes we only do it as a last resort. We only do it if there's no other option. What are your thoughts surrounding that?
Yeah, so I think it's an interesting one, because I think a lot of people think that scruffing is okay because it's something that the mother cat does to her kittens when they're teeny tiny, right? So she'll grab them by the scruff to move them around from maybe nest to nest. And I think therefore it's deemed that scruffing is okay because it's deemed to be a natural behavior. But I think the really important thing we have to remember is that scruffing behavior that the mother cat does to her kittens would only occur in the very first few weeks of life. So whilst those kittens are in what we call flexor dominance, so when the mother cat kind of grabs the kitten by the scruff, they get all curled up, so they flex their little limbs. Okay. And that only occurs for the first 2 weeks of a kitten's life. And then very soon afterwards, the mother doesn't adopt that strategy so often anymore. She may for a little while longer, especially if she's moving them, but it really only happens until the kittens certainly are weaned, which happens by 8 weeks of age. And then after that, scruffing becomes a handling practice that can potentially be really scary for cats. And again, I think what sometimes happens is we scruff cats and they freeze, and we think because they've frozen, that's okay because they're now no longer moving, protesting, fighting against. But I think we need to realize that the freeze response is one of the 4 Fs, which is another fear response. So just because they're freezing and because they're immobile doesn't mean that they feel okay about it. I think in terms of reading body language and the way that cats sort of express how they're feeling to us, I don't think that scruffing is an okay method to use, especially because we have so many other methods at our disposal now, whether that's gentle handling practices, the way that we prepare them for vet visits, the way that we try and handle them to alleviate that fear, anxiety, and stress. And then we've got the pheromones, the supplements, and then the psychopharmaceuticals that I mentioned. So I don't think there's really any room for scruffing anymore. And yes, you could argue, is scruffing them worse than giving them medication? I think when we're thinking about emotional state and what we're actually trying to achieve, I think scruffing increases fear, anxiety, and stress, and medication decreases fear, anxiety, and stress. So that would be my argument for going with the medication option over trying to restrain and scruff. And then also yeah, sorry, go ahead.
Sorry. Scruffing must be painful.
Yeah. Absolutely. I think scruffing must be painful. And so that's what I was just about to say. There's the learning, mustn't forget about the learning that occurs from that. So if we scruff the cat on this vet visit, what's it going to learn about how it's going to feel about future vet visits? So there's that piece, I think, to consider as well.
Absolutely. Yeah. Yeah, I think that's really important because you obviously, you do what you do with the knowledge that you have.
Yeah.
At the time, I've seen you write posts on LinkedIn about that, and that's really true. Maybe some people think, if I scruff the cat, it'll be more quick and we'll just get it over. Like that's what I've heard from people. We'll just get it over with quickly, and then that's better for the cat. But obviously, from an emotional point of view and from a pain point of view, it must be really scary for them. And then you've got that learning component again, like you said, and then the carrier coming out, and then the cat's just likely to be petrified.
Yeah, no, I agree with everything that you've said there. I think you're right, and we traditionally, that's the way that we've done things, for decades. Scruffing was something that was acceptable, certainly when I graduated from vet school, up until not that long ago. And just because we've always done something one way doesn't mean that that's the right way to continue doing things.
Yeah, just because we can doesn't mean we should.
Yeah.
In terms of kittens, I feel like there's kind of maybe a missing piece sometimes. There's a big focus on puppy socialization and puppy habituation, getting puppies used to sounds, to touch, to handling. Obviously, kitten socialization window is thought to be a lot smaller than puppies. But what advice would you give to people that have got a kitten and want to kind of help prepare them for vet visits and general handling, maybe by other practitioners as well? Maybe
I think what you've said just there is really important, knowing that socialization window is a little bit shorter than with puppies. So we think in kittens it's probably only up until about 7 or 9 weeks of age, depending which textbook you happen to read. So that's a short period of time, and usually the kittens are potentially still with their mums at that point. So it's always really kind of tricky to be able to exert enough influence on them in that socialization window where learning is really important. And there's quite a bit of research out there in terms of early handling. And so I think what's important is that short stints of very gentle handling are important. So cats in general prefer little and often handling over sort of long bouts of restrictive or restraining handling. So getting them used to sort of gently being handled for very short moments, just a couple of minutes at a time. I think that's something really good to do. And then if you think about what are going to be some of the things that maybe you'll want to do or your vet will want to do, will be to maybe have a look at their paws, maybe trim their nails. So getting them used to handling around that. And we always want to pair that with something that's going to be rewarding or reinforcing for the kittens. So a yummy treat, churros or creamy treats or licky licks or whatever they're called are great for those types of things. And then just being able to sort of touch them all over their bodies, maybe opening their little mouths. But again, what's most important, especially in that socialization window, is that the experience is positive for the kitten. So it doesn't matter if it's short. If it's positive, that's already an amazing thing. If it's long and it becomes a negative experience, we're probably actually taking a few steps back or working against ourselves. So just, I think, bearing in mind super short interactions, paired with either treats or play for kittens is often a really good reinforcer, and just, gradually, slowly, bit by bit, starting to introduce some of those handling pieces.
And obviously cats, that's really helpful. Thank you. Cats are obviously prey and predator species, so it's not always easy to read their body language, and I guess that's where your course comes in. But you're so right that it doesn't have to be long, just a positive, put a positive in the bank, and that'll soon add up. So
yeah. And I love that idea. Sorry, I was just going to say, I love the idea of putting things in the bank. That's a really great way of thinking about it, right? Putting positive experiences in the bank. I think that's a really great thing, good way to look at it.
Yeah, that's who's that? Dr. Susan Friedman, the trust account. Yeah.
Yeah,
exactly. So we don't become bankrupt. Yeah, I love that.
Yeah.
Thank you so much, Dr. Katrin. So you can find out more about Dr. Katrin over at Trinity Veterinary Behaviour. Obviously, you've heard Dr. Katrin speak now. You can hear she really knows her stuff. She's obviously been a vet for over 25 years. She's a board-certified specialist in veterinary behaviour medicine and fear-free certified. So do check out her website and her wonderful podcast, Pet Behaviour Chat. So thank you so much again, and I hope you have a lovely day.
Thank you. My pleasure.
You're listening to the Contented Catcast from St. Claus Academy with Lisa Sinnott. Email stclausacademy@gmail.com. You're listening to the Contented Catcast from St. Claus Academy with Lisa Sinnott. Email stclausacademy@gmail.com.